made it, if you're turning 65, getting ready for the good life, it's time to learn the A, B, C's, and D's of Medicare. I'm Marlin McKelvy. I will be your guide on this journey. I'm President of Consumer Directed Benefit Solutions. So first, come on here, there we go. A little bit of history for those of you that are a little bit younger. Medicare was signed into law way back in 1965, and it was a key part of Lyndon Baines Johnson's Great Society program. And in a bit of political theater, the first person to enroll was former President Harry S. Truman, who, by the way, if you didn't know it, was the first president that actually proposed national health care for the American people. So what is Medicare? Whoops, got a little ahead of myself there. Well, first of all, it is health insurance for people aged 65 and older. That's what most everybody thinks about when they hear the word Medicare. But you can also be under age 65 and be eligible for Medicare if you are subject to certain disabilities, and then if you are subject to end-stage renal disease. So this means that you're under kidney dialysis or a candidate for a kidney transplant. These are all situations where Medicare coverage could enter into a person's life. Now, who runs the Medicare program? Well, it's an aptly named organization called the Centers for Medicare and Medicaid Services. But in typical government fashion, who do you enroll with? Well, for most of us, when the time comes, you'll enroll with the Social Security Administration. The exception being, if you work for the Railroad Retirement Board will be your avenue into Social Security. So, original Medicare, as it was originally constructed, consisted of two parts, called, aptly enough, A and B. Now, to keep things kind of simple here, Part A focused on inpatient hospitalization type of services. Medicare Part B provided services that covered doctor's visits and outpatient health care, some medical supplies and equipment, and some rather limited preventive health care services. What a lot of people don't realize until the time that they're getting ready to enroll in Medicare is that really Medicare Part B is an optional coverage, that you have to pay for this coverage every month, and that the amount that you're going to pay for Medicare Part B is going to be based on your income level in your retirement years. So if you work really hard and saved a lot of money or making a lot of, still have a good income in your retirement years, you'll get to pay more for Medicare Part B. Yay. Also, there's a little deductible in there that you'll have to meet to satisfy your benefits, before you get to your benefits, I should say. Now, for folks that have worked 40 quarters during the course of their working lifetime, then Medicare Part A is paid for in full when you turn 65 and become eligible for Medicare. If for some reason you haven't, then you can buy Medicare Part A. It's $400+ a month. So get those 40 quarters in if you haven't already done so. Medicare Part B, as I alluded to earlier, does require monthly premium payment based on your annual income level. Those Part B premiums are subject to possible annual increases depending on what Congress does or does not do. So the fact that there was not a cost of living adjustment granted on Social Security for 2016 actually had some implications for Part B's premium and deductible for people aging in. And it's not locked in. So a lot of people think, when I first enroll, that's it. No, they can kind of keep escalating on, once again, kind of at the whims of Congress. But now in 2016, we're quite a ways away from 1965. Medicare coverage is more important than ever. It's estimated that today, a person turning 65 and going into their retirement years will probably incur in excess of $250,000 of medical expenses during the remainder of their lifetime. So, original Medicare solved senior citizens' health care financing problems, right? Not exactly. Because Medicare Parts A and B really only cover about 80% of hospital and doctor services. And both of these programs have deductibles associated with them. The Medicare Part A deductible for hospitalization is, I believe, $1,266. It's $166 if you're aging into Part B. There are limitations. So basically, if you just had Medicare Part A and B, there was still the opportunity for some pretty significant financial exposure if you had some health care issues as a senior. And most importantly, original Medicare did not cover outpatient prescription drugs, which in 1965 wasn't that big of a deal. There weren't that many drugs, and people didn't live near as long. But today, totally different thing. So over the years, we've been constantly tweaking with this. Some of the first solutions were the introduction of Medicare supplement plans back in 1992. Now these plans, come on, work with me here. There we go. All have these very imaginative ABCDs, have different designations here. These policies fill in some or all of the gaps of what are not covered by Medicare Parts A and B, and they are administered and sold by private health insurance companies through independent agents and captive agents as well. I'm an independent agent, so I can work with a wide variety of companies to find a fit for somebody. But still, even at this time, prescription coverage was not addressed by Medicare supplement plans. So, fast forward a decade or so, the next round of solutions was the introduction of Medicare Part D prescription drug plans and Medicare Part C, which are also known as Medicare Advantage HMO plans. Now, Medicare Part D, you can see we're passed back in 2003. This illustration here gives you sort of a generic example of what a Medicare prescription Part D plan might look like. Most of them do have an upfront deductible, $360, and then your co-payments or co-insurance level of coverage kick in until the total cost of your drugs in this year reached $3,310. Then you cross over into what is referred to as the donut hole. This is an area where your coverage drops somewhat, where you're paying 42 to 45% of the cost of your prescription drugs until your total accumulated cost reached this year a threshold of $48.50. And then if you're still racking up prescription drug costs, you've moved over into your catastrophic level of cost where you have a much more reasonable cost sharing of either the greater of 5% or $2.95 per prescription. The Medicare Advantage plans, on the other hand, combine the features of Medicare Part A and B along with gap-filling features we associate with the supplemental plans I just described. Plus, many of these plans also bundle in prescription drug coverage, plus other value-added benefits, perhaps some dental care, vision, hearing services, health club memberships, various perks like that. These plans are also offered exclusively through private health insurance companies, and they often have little or no monthly premium associated with them. So at first glance, that's a very attractive option to many people that are looking at Medicare. The catch is with these programs is that they do lock the user into a network of providers, and some of the plans do have a referral scheme set up where you have to get a referral from your primary care physician first before you can go see a specialist. So they're sometimes a rough transition for many people, and we'll talk about that a little bit later on. Work with me here. Why is this not? There we go. Okay. So anyways, in 50 years, we've gone from a one-size-fits-all type of solution to a multitude of options with a lot of different costs, benefits, and requirements. The result is a lot of confused senior citizens. And really, the way things change with prices and players, you need to review your Medicare options really on an annual basis. But wait, there's more. Remember those Medicare supplement plans I was telling you about? They all cover the same thing. So it doesn't matter whether it's Mutual of Omaha, Aetna, whoever, a Plan N is a Plan N, a Plan A is a Plan A. You'd think then that they'd all cost the same, right? Wrong. Whoops. Went back. For example, a very popular Plan F, which you can see covers virtually everything that isn't covered there. The cost between the lowest and highest cost Plan F supplement can vary by more than 100%. So just buying based on the name of the carrier can be one of the biggest financial mistakes that a senior makes. And of course, there's even more. Not going backwards. Not the first time that's happened. All right. There's some basic questions a senior, especially someone aging in, has got to answer. When should I enroll? There's a certain time frame that they can do that. What if I want to enroll in Medicare Part B late? Well, that's perfectly all right, and no problem at all if you don't mind paying a penalty for that privilege. Simple questions like, what payment method should I choose? And then one of the biggest Medicare mistakes I see out there is people delaying enrolling in Medicare Part D, the prescription drug program. That healthy guy or gal at 65 is going, yeah, I'm not going to do that. I'll wait a few years. Well, that's fine, except you have a premium penalty that will be assessed that will follow you the rest of your life. So at 1% per month, it may not sound like much at first, but as this chart here shows, you just wait several years, the penalty itself may be more than the monthly premium for your Medicare prescription D drug coverage. So if somebody that's aging in really needs to go ahead and enroll. Another important thing, did I mention doctor availability? Does anybody know who this guy is?
Robert,
Yeah, Dr. Welby, yes. All right, oh, come on, finger, here we go. All right. Medicare enrollees should not just assume that the doctor that they want or they've been using is automatically accepting Medicare patients or new patients. And this is especially so if the person is considering enrolling in one of these Medicare Advantage plans. So it's very important that they check before enrolling or have somebody like me that can help them look through that provider directory and find out who's in and who's out. Now, why is this? Well, it's due to the government mandated payment levels, and they don't pay Medicare patients as much as the doctors get in the open marketplace. So more and more of them are either refusing to see new Medicare patients or are limiting the size of their practice that they will allow to be dedicated to Medicare patients. This chart is way back in 2008. I can assure you that number for doctors not accepting Medicare has gotten larger since then. So as you can see, we're full of a situation here with a lot of choices and decisions. I've kind of touched on those. As you can tell, the senior has an awful lot of ways that they can go. So basically, in conclusion, Friends Don't Let Friends by Medicare Work. I want to thank you for viewing this introduction to Medicare with me. I hope you found it informative. There's a lot involved in Medicare, as I've been making clear today, and making an educated purchasing decision is very important. This is why you need the guidance of a professional insurance person like myself that's knowledgeable in this area, and Consumer Directed Benefit Solutions stands ready to be your trusted advisor in meeting your Medicare needs.